So definitely as we go through our 30s and we hit our 40s, the body has seen a few more years and the joints are a little bit more worn and more prone to injury, joint injuries. We see a lot of hips, knees, ankles that have done a lot over the lifespan. So it is definitely a big part of our work. I think the big thing here is being able to understand, and for anyone, if you're in your 40s or in your 20s, you're a bit more robust in your 20s, but is the most important thing is to prepare well. So you need to put in the foundations that are required for the sport that you're doing. So a lot of field-based sports might require a base level of strength to be able to put force into the ground, which is an important thing to be able to do to absorb forces, but also from a performance perspective to be able to push off hard and evade an opponent or sprint hard. So preparation, putting in the groundwork early, planning is really important. So especially for the older cohort, there was a colleague that used to talk about some of the older athletes when I worked in the footy club, and he'd talk about a player having only so many kilometres left on his clock because he had a degenerative arthritic hip joint at 28. So making sure that you factor in, you go when you need to go for your main session, but then there might be a light session during the week where everyone else is training and you're in a special model of doing a light running session or even an off-leg session. So you can still get the aerobic benefits from another modality. You're not putting stress through that joint, and you're looking after yourself and having a little bit more recovery associated. I think patience is really important, especially in those early stages, to build the foundation. Strength doesn't happen overnight. We need to ensure that we are really guided in our metrics. So where do we need to work? Let's find the deficits. Let's work on those. Let's not just throw something at the wall and hope it sticks. There's a study in Queensland Strength Sports Science. Tim Gabbett produced a study many years ago now, but he developed this concept called acute versus chronic workload. So acute workload's what you've done this week, your chronic workload's what you've done in the last 4 weeks. And so the rough, from that research, we concluded there was a metric, a special number that you don't want it to be more than 10% of your acute to chronic workload. So you want to just take that 10% rule, you're increasing 10% each week if you're looking at week to week. If you are saying, I've had 3 months off and I want to build up to a footy season, then you need a minimum of 8 weeks to build yourself up to that. Anything below that, you're putting yourself at risk. If you've had 3 years off sport, you haven't run for 3 years, well, you probably need 6 months to build yourself up, get your running loads up, your speed, your agility, all those things that we need to get up. And then training, it needs to be a lot longer because you haven't run, so you need to start to get the impacts in and get the body used to running again. So it is variable and depends on how long you've had off legs. But if you say a general rule, you've had 1 to 2 months off, a 4 to 6 week block would be substantial. To get them up. So long term, you need a longer one. Medium term, you've got about 8 weeks, and then short term, maybe 4 weeks, 4 to 6 weeks. Recovery is really important if we're considering recovery of body tissues and we're cycling our load days and giving it a download day. If you're talking about recovery in terms of the latest gadgets and stuff that are coming out, like recovery boots, it's all about how it makes you feel. Walking in water, ice baths, saunas, all these things are based off how the athlete feels, and that's what the current evidence says. But if we talk about recovery in terms of, my hamstring needs to recover from sprinting, because we know high load for hamstring is sprinting. I've done a sprint day, I need 72 hours before I sprint again. That sort of recovery is critical for body tissues to ensure that we don't get injured. Definitely, a level of soreness is normal through sport, especially in those early pre-season phases where you're building up and you're developing delayed onset muscle soreness, DOMS. It's your first couple of gym sessions, you're getting DOMS. If we're seeing that it's, you've got DOMS, you've got soreness, it's both legs or it's both arms, look, we're pretty happy because it's more of a systemic response. If we're seeing one area, it's like, oh, I was a bit sore, then I was okay, but then my calf was still really sore and it's still sore now, then our index goes up for there could be a calf injury here. So both legs, yet we're happy, it gets better within a week. If it's something that goes outside a week, becomes really localised or focal, then we start to worry. Learning to listen with your body comes with experience and age. Your younger athletes struggle with that at times. I've worked with a lot of young ones and they're like, I'm fine, and then they break. So I think listening to your body is crucial. Something that you can work on by working with your clinician, and they can educate you on what to listen for a bit more. But it's something that you should develop if you're a lifelong athlete.